Started here. So my name is Doug McCallum, and I'm in charge of the senior ministry here at St. Mark's. And so if you have any questions about St. Mark's, anything that you're curious about, come see me. I'm at the back table back there. I have a colleague back there. We can answer your questions. If you're new to here, the restrooms are straight out this hallway, down at the end of the hallway. Those are the only restrooms there are on this end of the building, kind of thing. If you parked on the north side, there's a shorter way to get to your car than the way you came in on the south side. So see me and I can get you to your car easier than going all the way around the building. But if you park on the south side, you're in good shape. Is there things that we need to work on? Let me know. I know it's cold in here. We fight this all the time. And if you have enough body heat, it will eventually warm up. That's on you. So, we're thrilled that you're here. We moved it into here because our concern was that for the topic, we were going to outgrow that space. Fire marshal wasn't very happy with me last time because I put chairs in front of the exit doors, and he reminded me that I can't do that. So we moved it in here. So this is kind of a test run to see whether this space works for us, works for Savvy Seniors. So let us know your thoughts about that whole thing. So we're thrilled you're here. We've got a great panel, great topic today, and so on.
Well, welcome everybody. My name's Alicia and I'm with Nebraska Savvy Seniors, and it's good to see so many people here today. We have a big morning plan and actually a big afternoon too. How many of you guys like a free lunch? Raise your hand. Okay, well, Susan over there has invited us all to Stage 2 Living at 47th and J. Right after this, we're going to have a barbecue up on the rooftop, right? Yeah, it's going to be a fun party. It's serving everybody lunch, so make sure you follow Susan over there. So today we're going to talk about Medicare. And actually, this is a subject that's a lot more confusing than it really should be for most of us. It has so many parts, A, B, C, D, E, F, G. You feel like you're, eating vegetable soup or something, right? But you're going to go back to school today, but I promise we won't give you a quiz afterwards. But you will gain a lot of knowledge. I want you to just first raise your hand if you have gotten anything from Medicare in the mail, or Medicare supplements, or Medicare insurance, or anything else to do with Medicare in the last week. Okay, good. So, we're moving right along. Everybody's in the same kind of group. So, it's kind of hard to sort some of that out. But just as a disclaimer here before we start, Medicare rules can change about as fast as Nebraska weather, can it? So, we're going to do our best to kind of clear that fog for you today. The good news is, we're not going to add to the confusion. Instead, we're going to cut through the noise, simplify things, and hopefully leave you all with some answers and some peace of mind. So when it comes to Medicare, understanding what it is and how it works and your options are the best gifts that you can really give yourself. And since it's open enrollment, it doesn't start today or start the 15th. It starts the 15th. You got one up on that, okay? So let's dive in, and I promise by the end you'll feel more confident about navigating the mysteries around Medicare. So on our panel today we have Molly Stoles, and she is from Aging Partners, and she's an Aging Partners Benefit Counselor. And we have David Tuttle, and he's from American Senior Benefits. And we have Danielle Kanaev, and she's from New Dawn Insurance. And we have Eric Hansen. And Eric is with the SHIP, which is the State Health Insurance Assistance Program. So now I'm just going to let them tell you a little bit more about themselves and what they actually do. You can go ahead and start, Molly.
Okay, I'm Molly Stoles. I'm a benefits counselor at Aging Partners. So primarily I assist people who are new to Medicare, getting on Medicare. I assist with Social Security applications, Social Security questions. I help with homestead tax exemption in the spring, and then I can answer some questions about long-term care insurance. I'm not an insurance agent, but I do just provide information and education to our participants.
My name is Dave Tuttle. I am an insurance agent. I deal with Medicare and the ever-changing Medicare. I am a professional who's done this for 16 years, so you're not going to probably stump me. I'd like to say that, but then Medicare will change the rules on us. So it's an ever-changing insurance, to be honest with you. So
I'm Danielle. Can everyone hear me? Okay, fantastic.
Loud enough?
Not very well.
Everybody's awake now. I'm Danielle Canivey. I own a new Dawn Insurance. So I'm an independent agent who's a broker. So I cover all of the different plans that are available within our county. I got my start in the insurance business. Many of you have heard my elevator speech, so my apologies. I've been here for a couple of years with Savvy Seniors, but I actually got started in the Medicare world after assisting my father-in-law, whose plan was to work until he died so he never had to figure out retirement or Medicare. That didn't work for him. So we had to take a really quick, deep dive into the world of Medicare, and I just recognized how overwhelming it can seem. Especially when oftentimes you're making decisions at a time period in which you have a lot of other things you're considering or worried about and stressing about. So that's really where I started my business as an opportunity to work with seniors to help you to feel just more comfortable and confident and educated in making the best choice for you. My apologies for the in and out.
Hi, my name is Eric Hansen. I'm with the the State Health Insurance Assistance Program, or SHIP. I am a retired Nebraska educator. I taught in Nebraska for 30 years, and after I retired, I work with the SHIP program, and I'm a staff person now. I'm the regional volunteer coordinator. I manage about 70 volunteers in Nebraska that go out and assist all of you people with your Medicare needs. So I also meet people one-on-one in our office, as well as do presentations and panels like this. This is my first panel here, and I'm excited to be here. Lots of information we provide. We're also a part of the SMP network, which is Medicare Fraud.
Okay, great. So we have a great panel here. These guys don't know the answers to the question. I don't think anybody will. So we're just going to start right off with you, Molly. Molly, can you tell us what's the biggest misconception that people have about Medicare, and where can they get unbiased answers to those questions?
Yeah, so I think the biggest misconception is how much Medicare is going to
You're going to have
cost.
to.
How much Medicare is going to cost. There's a lot more cost involved to Medicare, and there are so many more options with varying degrees of cost that it's important to get the information about what you're going to be spending in retirement when you're on a limited income. And then the best places to get unbiased answers would probably be from Aging Partners or Nebraska SHIP. I am a SHIP volunteer, so I receive all my training from SHIP, but I am employed with Aging Partners.
Okay, great. Dave, first question for you is how do Medicare decisions interact with retirement income and planning for all that? Or do they interact with each other?
Oh, obviously, yes. Anything you would do in this time of your life, there's two times in your life. There's when you've made your money, and then when you're going to spend it. So it's the preservation time. They work hand in hand, and it's a lot of times some of the decisions that you end up having to make are contingent on some of the earlier decisions that you made. So yes, they do go hand in hand. You need to make sure that you're doing the right thing for you personally, because At this time in your life, it's all about you. It really has to be and should be.
Okay, great. Danielle, how do you guide seniors and people who are retiring through comparing multiple Medicare plans with confidence? Because there's a lot of them.
Absolutely, Alicia. You're totally right. There is a lot, and it's the alphabet soup for sure. So it gets really overwhelming when you're trying to navigate at first what your different options are. So what I usually do is I have a presentation that we go through that doesn't even get into plan specifics to start off with, because when you're learning a new language, which oftentimes is what it seems Medicare is, you need to learn the fundamentals and the basics. So we're talking about the difference between Medicare Part A and Part B, and when you want to engage with those and what that looks like. And then on top of that, talking about, is there some other additional supplemental things that you want to look at, like a Medicare Advantage plan, like a supplement plan, like your prescription drug plan. So it's really getting to the nuts and bolts of it. And then after I know that you feel confident in understanding the basics of Medicare, then we can start drilling down into what does your monthly budget look like for you, what like your core philosophies, how involved do you want the insurance companies to be in decision making between you and your doctor. So there's some philosophical conversations that we can have. And then after that, then we can start digging into the different plan specifics at the different carriers, what they offer, things to consider, whether it's an advantage or a supplement plan.
Can't hear you.
Thank you. Can you hear me now?
Yes.
Okay. Isn't there a cell phone carrier that can you hear me now? So it's really about understanding the basics is the primary, that's where we have to start. And I think that out there's so much information. And so like Molly had talked about, you really need to make sure you have a firm understanding from an unbiased source. So whether that's SHIP, whether it's a broker that you find that you really feel confident in, there's some YouTube videos that are out there that are really fantastic as well. But you have to be an educated consumer before you can even start looking at your different plan options. Because there are decisions that you're going to make at the beginning that will impact how you receive health care. And so you really need to understand what that looks like.
Okay, great. Eric, can you tell me what services SHIPS offers and provides that people might not be aware of?
Certainly, we provide many of those unbiased educational services, like many people do. But some of the things that you may not be aware of is we also assist people with the low-income subsidy applications, and those are for people that have lower income that can certainly apply to get help with their prescription drug costs and premiums. That is one thing that SHIP counselors are able to do, and we do that. We also provide fraud education. Fraud in the United States is well over $100 billion a year business, and there are many fraudulent activities going on, and we provide that information. We have a person on our staff, her name's Carol Hara, who deals specifically with fraud, and so if you would have something happen that you need to talk about, certainly she would be the person in our office to talk to about that. She reports that to the federal government. And the last thing is a little bit lighter, I guess, service, is a newer service, is we actually have a podcast now called What's Up with Medicare. Our director, Jonathan Burleson, really provides that. If you are on a phone and have any kind of Spotify, any of those programs, you can look it up. It's called What's Up with Medicare, and a really informational podcast that you can access.
So on that podcast, do you update people with the changes in Medicare and keep people up to date?
There's lots of information, yes.
Great.
Topics like that, as well as other topics, fraud. He talks about a lot of topics, but yes, certainly updates as well.
That'd be a great resource for everybody to tune into. Molly, this is a big one that I struggle with. I don't know if everybody else does, especially since I'm kind of new to Medicare as of about a year ago. But what is the main difference between original Medicare and Medicare Advantage?
How much time do I have? So primarily, original Medicare consists of Medicare A, Medicare B, a Medicare supplemental plan, and then a drug plan. I would say original Medicare is typically front-end loaded, so you're paying high premiums, typically lower copays and deductibles at the doctor and at the hospital. We all know Medicare drug costs can be sort of outrageous, so you're gonna probably spend more per month on premium than you are on your health care. Medicare Advantage is an alternative, so it's privatized Medicare. It is consists of your Medicare A or Medicare B, and then an insurance company manages your A and B benefits as well as drug benefits if that's included in there, and that's going to be back-end loaded. So typically you're going to have low monthly premiums, and you're going to have copays and deductibles, maximum amount of pockets you're going to need at when you go see doctors or you go to the hospital. So it's sort of how you're paying out your fees per month or per hospitalization doctor visit as you use those benefits.
Okay, so that was a loaded question, huh? So Dave, you're next.
Okay.
What strategies do you recommend for seniors who are balancing that healthcare cost with other financial priorities? You know, if something has to give, should they give in the area of their insurance coverage?
Well, insurance is in a very important part, but it's a part. Okay, but we have to know, and you have to know personally, back to the individualized, how much of a part should it be, or can you afford? You know, healthcare, especially when you get on to Medicare, there's two ways of doing things. One thing you need to understand is the Medicare supplement route, that's all standardized. So your G plan is the same as the person who's got the G plan right across the table from you. They're all the same. They're a pay up front plan. Now the Medicare Advantage, that's pay as you go plan. So you have two different philosophies you want to decide between. Okay, the pay as you go, that covers A, B, and D by a private insurance company. Your Medicare supplement is also a private insurance company, but they're paying the 20% that your Medicare doesn't. So, and then you need a drug plan to go with that. So there's a lot of moving parts when it comes to that, and there's way too many moving parts for you to know. You can't know it. You just can't. Because Medicare doesn't let you. And unfortunately, the only thing consistent with Medicare is change.
Okay. Danielle, kind of the same question, but a little bit different, and some of these questions will kind of overlap on each other a little bit, but everybody has a different perspective. So what criteria to use when you determine which plan might fit someone's individual lifestyle according to their lifestyle and their health needs?
I think this is a great question, and I think that that's where it's so important to sit down with someone, whether it's SHIP or a broker, to just understand, because everybody's situation is so different. And the interesting thing when I was looking at this question and thinking about it, you're planning not just for what's happening next week, but you're also planning for what's happening 10, 15, 20 years down the road. So my kids this past weekend were introduced to the magic 8-ball of like ask it a question, see what the answer is. And that's kind of what we're doing here too, is we're considering your lifestyle and health needs right at this moment, but also planning for what does that look like. If you do have some type of health situation that occurs, and making sure that you understand with an Advantage plan, if I go that route, here's what that looks like next week based off of my current health needs. But also 10 years down the road, here's what that could look like if I have additional needs that are that I'm needing to make sure are taken care of. With a supplement plan, I have these needs right now, how does that cover, and then what does that look like in the future? So of course it can be a little bit tricky, but I think a huge consideration is budget. right? There's some people that we can sit down and we can talk about Advantage Plan and Supplement Plan, and they can say, wow, I love that idea of front loading, like you had mentioned with the supplement plan. That sounds more of like the path that I would like, but I'm struggling to pay my grocery bills right now. And I would say at that point, then you need to make the choice that makes the most sense to make sure that you can eat for that month. And then we're also talking about, are there some other programs that are available to you? So there's some things that you have the ability to consider your options. There's sometimes where you don't have that ability to consider your options. But then we're also talking about a Medicare Advantage plan. Yes, that could be a lower monthly premium, but then if you are hospitalized, if you do need additional care, what does that look like? What is your potential exposure to costs? Are there opportunities to mitigate that? Are we making sure that you have a savings account that you're building up to making sure that you have funds to cover anything that you incur, any costs that you occur from something that happens medically? So I'm sorry that that's like a really vague answer, but the answer is that because all of your lifestyle choices, your budget choices, everybody is so different as to where they're at. That's why it's so important to make sure that you're sitting down with someone to talk about all of the different options and making sure you're educated on where you're at, what your options are, so that you can make the right choice.
Okay, thank you. Eric, how does someone use SHIP to avoid making costly Medicare mistakes? I'm sure you've seen some mistakes people have made in their planning, and sometimes it wasn't really a mistake, they just didn't know what the future held. But how can you help people mitigate those mistakes?
Well, we certainly don't make decisions for people on their insurance. We only provide that educated information for you to make your own choices, because everybody's different, just like Daniel said. Everyone has different needs, and so we try to provide the best education so people can make those choices. Sometimes people aren't aware of when they're supposed to enroll. You have an initial enrollment, a special enrollment period you could possibly use. We do provide that information so people know they don't miss those deadlines where they could have a penalty for not enrolling at the appropriate time. Certainly, if you're looking at windows or enrolling in Medicare supplements, there are rules with that. When you can enroll, and after, if you miss your window for that, how that's going to affect you, and that could be a financial cost as well. Or if you go with Medicare Advantage, certainly we educate, because there are plans out there that may not suit you that you need to look at and decide. And we certainly don't tell anyone what to enroll in. We just try to provide that education so that when people go to enroll those plans, it works the best for them and they make the best choice at that time.
Okay, good. Molly, what strategies can we use to maximize those healthcare benefits for Medicare and still minimize out-of-pocket expenses?
Yeah, so we look to see, we screen everybody who comes into our office to see what programs they're eligible for, whether it's Medicare or Medicaid, extra help, or if they're eligible for like a homestead tax exemption, to try to see if we can get premiums covered through Medicare Part B, reduce drug costs through Medicare Part D. And then we also want to look at, what do you want out of your Medicare? Are you going to be traveling? Do you have physicians that you specifically want to see? Where do you plan on just like being? Are you planning on moving out of state? Those sorts of things. So we try to find out anything that you're eligible for, and then what options are available and what you're hoping to get out of your insurance.
Okay, good. And Dave, are there any hidden costs in Medicare Advantage or supplemental plans that people should know about that they don't really see up front?
Well, one plan, the pay up front plan, that's your Medicare supplement. The only thing that differs in that plan, by law, it has to cover certain things. And the only difference could be price and service. That's it. So there really aren't any hidden costs that a person would pay for on a Medicare supplement. Now, a Medicare Advantage, that's a whole different ballgame, because there are moving parts when it comes to a Medicare Advantage plan. It's broken down into three parts. You've got your, what you're gonna pay for co-pays and co-insurance, that's the first part. The second part is, what are they gonna do for your drugs, your medications, I should say. And then they offer a bunch of, the third part is allowances to go with it, such as dental, vision, hearing, out of pocket, over the counter, things of that nature, free gym membership and so forth. And those are the things a person should really kind of look at is, what's more important to you? Is it the safety of knowing you won't pay a dime once you've satisfied the deductible with your supplement? Or is it, I want all those little extras, and then I'm willing to give that up, and knowing that the only time I pay on a Medicare Advantage plan is when I go. You don't go, you don't pay. So, and they both have their pluses and minuses, but like Danielle says, everything is individualized. What's good for you may not be good for you. But you got to recognize that. So.
Okay, so we all know that with open enrollment come changes, right? Everything changes, even Medicare. So Danielle, what are some of those new changes to Medicare that we need to know about this year?
Great question, and today's an exciting day because we're not allowed to speak about any changes that are happening until October 1st. So you're probably going to start seeing a lot more from plans that are coming out that are sharing with you the specifics of what they're offering this year. So from what we've been hearing, from what we know, there's a few things to talk about. So last year, you probably heard Dave or I here, or maybe if you have a broker or a volunteer that you work with, talking about the changes in your Part D. So if you have a Part D program, a prescription drug plan, there was a shift, and also with the Advantage plans, they had a max out-of-pocket shift this past year. And they also had a new program called the prescription payment plan. So the idea was that instead of having really heavy costs at the front end of the year, you would have the ability to segment that through the 12 months of the year. So that will be continuing for this coming year. I would say if you found that last year you had heavy costs for prescriptions up front, that's definitely a plan that you're going to want to consider enrolling in for 2026, and ask any of us if you need some additional information on that. What we're seeing from the carriers that we've gotten information from is that there may be a few less plans this year than there had been in 2025. There's also some carriers that might be leaving different areas of Nebraska. I think that previously there was so many plans with so many offerings that for me as a broker, it could get a little overwhelming trying to tell you why these 15 plans are different and what the differences are. So for me, that's kind of, I don't see that that's a really bad thing. I think that insurance carriers are trying to figure out what do people actually need, what are they actually looking for, and then streamlining what their options are for that. So we did have this past year, there was a prescription drug plan that was very, very minimal cost. I haven't seen, have you guys seen? I don't believe we'll have a zero cost prescription drug plan this year. So there may be some rising costs for prescription drug plan. AI this morning told me that what they're saying is that the Advantage plans as a whole, they're seeing premiums going down. But again, we'll have those particulars here in the next few weeks that we'll be able to disseminate that information. We have not heard Part B, so your Part B that you're paying, I think it's $185 this year, will probably go up. But I have not heard, have you guys heard a definitive number?
We've heard not definitive rumors, but yes.
Yeah. So there's going to be some increased costs that you'll have this year with your Part B. I think that, again, this time of year, if you are not looking at your plan, you're doing yourself a huge disservice. So whether it's an Advantage plan or a supplement plan with prescription drug plan, and this time period is when you can change Advantage plans, prescription drug plans. Any time of year, you can take a look at your supplement plan. So whether it's this time period or another, It's a great time to take a look, but you're doing yourself a huge disservice. And if you say, you know what, I don't want to meet with anyone, I've got people for everything, I want to do this from my own home, Medicare.gov is a great resource for you. You have to be able to navigate to put in your prescriptions, to put in your doctor's information, but it's a really great resource for you to know all of the different offerings. So I think there's changes. 2025 with the different prescription changes was a huge one. I think that we're seeing carriers recognizing that people are engaging more in their healthcare. They're going to see the doctor a little bit more. So I think that we'll continue to see shifts in this space. I think that we're hearing a lot about Medicare Advantage, Medicare Supplement in general in the news. Are you guys hearing that? Like I was prepping and getting my information ready for this, and I just heard yesterday we're gonna have a Trump RX in 2026, maybe, who knows? So I think that things are constantly changing, constantly evolving. The key is you wanna have someone that you can reach out to ask questions, to make sure that you have a firm understanding of what is changing and how it's impacting you. Because it could be that there's little to no impact to you, or it could be that your supplement rate is going up 15% this year, and we need to have conversations about what that looks like. So, you guys probably have info too, did I miss some specific things that are?
Can any of you add to that? Any other changes that you're aware
Well,
of?
I think, how many out here have heard the term donut hole?
Explain that.
Well, I want to know how many's heard it. Guess what? You won't hear it again. They got rid of it.
Unless you're at Randy's Donuts.
Oh, yeah.
And then donut closer.
But the number, we do know the number for next year. So what they did is they decided to put a cap on how much money a person has to pay. And that cap for this year is $2,000. So they rid the donut hole. So those people that have high dollar meds just got given good news. I know it's Medicare, but it's still good news. But so going forward next year, we already know what that number is. It's $2,100. That's the most you're going to pay out of your pocket toward your medication costs. So
That's good news for a lot of people.
it is good news for a lot of people, because if you have even one high dollar medication, it could be devastating to you. And to get to that donut hole used to take you forever and take you to take your bank account away. So the good news is this is one good thing they've done, I've seen, and this year it's 2,000, next year it's 2,100. Just know that no matter what you take, that's the most you're gonna pay, and that's a good thing.
Anything, Eric, to add to that?
Just to piggyback on that $2,100, make sure it's $2,100 for covered drugs. If you have a drug prescription that is not covered, that is not going to qualify for that $2,100. It has to be drugs that are covered.
What happens if they aren't drugs that are covered by Medicare?
They pay out of pocket for it, or they look for another prescription from their provider that may work for them, or there are some programs, pharmaceutical assistance programs, that do help with some of those really high-cost drugs that are available, and we assist with that too.
Okay, so if that's your case, give Eric a call. Eric, what are some of the most frequent questions that you do hear from Nebraskans about Medicare?
Yeah, there's a lot.
I bet.
We do have an 800 line, 1-800-234-7119. That's our hotline at the SHIP office. If you call it, you might get me on a day when I'm on the
Repeat
phone.
that slowly for
Sure.
anybody who wants to write that down.
It's on our pens back there, that,
Okay.
and the blue table. Grab that too, but it's 1-800-234-7119. And it will ask you where you want to talk to, Omaha, Lincoln, Scottsbluff, but you can select any of those and talk to any of those people. If you select Lincoln, you might get me or one of our other staff people. But certainly we get calls and questions all the time. And I would say one of the most frequent ones is, do I have to enroll at 65? Do I have to enroll? Am I required to enroll? Does anybody know the answer to that? Do you have to enroll? Okay. Okay, so the answer is no, or it depends, is what I usually say. It depends. If you have employer insurance and you're working, you don't have to enroll in Medicare A or B. And people question me sometimes on that, and I probably have that question almost every day. So if I've been telling people wrong for 8 years, I have, but I don't believe I have. So as long as you have employer insurance and you're working with that insurance, you do not have to take Medicare. And then the next question will be, well, won't I have a penalty for not taking that Medicare at 65? No, the work insurance is your guarantee that you will not have a penalty. It has to be credible insurance, which most people's insurance is through work. But you don't have to do that. You can put that off until you retire and then enroll in Medicare, provide the information from your employer that you had those years of work insurance, and there is no penalty for that. So people get that information from friends and relatives because they've heard it before. So if you don't enroll, you're going to get a penalty. But there are certainly things that you don't have to do at that age. The other question is certainly, where do I enroll? Where do I enroll? How do I enroll in Medicare? No one's told me this. I didn't get a letter. Nobody told me how to do it. Where do I go? Well, certainly, when we get that call, we tell them, the first thing you do if you're going to enroll in Medicare is you need to either do it through the Social Security office or online at the Social Security website. You can enroll in Medicare A and B. There's no choices there. A and B, you take those applications and you do that. We can't assist with that in our office. That's something we don't do, and people ask us to do that, or they coming in thinking they're going to do that for them. We can't do that portion of them. That's something that people have to do themselves, unless they're seeing someone else that's going to help them do that. So that's another question. How do I do it? How do I get enrolled? And we provide that information on how to do that. Yes, ma'am.
So enrolling and doing and actually taking insurance. So you have to enroll.
You do not have to do anything. Nothing. No. You do absolutely zero. Nothing. They won't send you a letter saying, why didn't you enroll? And they won't send you a letter saying, this is your time to enroll. Okay? So you have to do that. You have to make that enrollment when you do a retire. The only time you would be enrolled automatically is if you're taking Social Security benefits. You do have to take Part A if you have Social Security benefits. But you're not required to take Part B, and you can continue to work with that if you're taking Social Security. But if you're delaying Social Security, you will not be enrolled in Medicare at all.
Okay. All right,
Yes.
well, Molly, back to you. Can we just hold the questions till afterwards? That way we can get a mic and everybody can hear the questions. Just don't forget, okay? All right. So Molly, we all in Lincoln and Lancaster County are very fortunate to have aging partners here and available for us. So thank you for all that you do. Can you tell us what other resources Aging Partners provides to help seniors and guide them through that enrollment process?
So we offer one-on-one appointments. So I am a benefits counselor. We have another benefits counselor named Clint. He's there part-time. We also offer care managers. These are people who are assigned. They have specific clients that they go out and see, and they will also provide those one-on-one appointments. So we sit down with somebody, they bring in their medication list, they bring in the plan that they're currently on. We go through Medicare.gov, we compare it to what's available, what's the most cost-saving option for you, and we can help complete the enrollment with them and go over all the pros and cons of maybe switching or staying with the same plan they're currently on. We also have our CHSP program, which is their senior housing, and so we have care managers in those buildings, and they can assist with all of those enrollments. We have our first service area and their community resource specialists. They can also help with enrollment, so we're kind of all over the place. We have a lot of resource available, people to sit down and chat with you. Even I have people who come in and say, well, I don't know if I need an appointment during open enrollment, I just want to talk about my plan right now. We can do that. We offer appointments all year long and we can chat about your Medicare options. I think a lot of people sign up for plans when they're first eligible for Medicare. They don't need to use it until they get a little bit older, or they have a health problem come up. So if you just need help understanding your benefits, what you've got right now, what does your plan cover, we're more than happy to sit down with you and just chat about those options. And then all of our services are based on a suggested contribution, so you're never actually charged for a service. If If you want to make a contribution, you're more than welcome to, but it is not a requirement.
Oh, that's good to know. Good. Dave, I'm
Yes.
gonna skip a couple questions on you because we've covered some of those. But Medicare is a government program, but it sounds like it actually changes from state to state. So what do you do, and how do you advise your clients who are planning on moving, or if they spend time out of state, is there an amount of time that they have to spend to get benefits in each state, or how does that all work?
Well, normally, what used to happen, I've been doing this 16 years, so I've seen all kinds of things. But what they've gone to now is, if you are a snowbird, so to speak, and you go somewhere else for that time, your plan now will follow you. You will have, especially if it's a Medicare Advantage. Obviously, if it's a Medicare supplement, you can go anywhere in the country and not worry about it. But if it's a Medicare Advantage, what they kind of got smart about it. They like, well, what about all these snowbirds and whatever that is? I don't know. I'm not a snowbird. But it will follow you. As long as, let's say you use company A as your insurance, and you go somewhere else for a few months. All you have to do is tell that company, and we're not being specific at all about companies today, hey, I'm going, and all you got to do is go to one of those companies' doctors if you're out, and it's not an emergency. If you're out and about and it's an emergency, it's covered, regardless. By law, they have to cover what you do, but you can, if you go to Arizona, let's be specific, and you want to have coverage there, you just have to go to a doctor who takes the plan that you're on. So that's kind of a nice thing that they've done. That just happened a few years ago.
So you have to ask those questions when you make those appointments if you're traveling.
Yeah.
What about if you're with Savvy Seniors and you take a travel trip out of the country and something happens? Then what happens?
Now, out of the country, it's a little different. You do have coverage through whatever insurance you have, but sometimes it could be limited, and those are questions you would be good to ask before you go. Well, okay, what we've seen some people do is they just get travel insurance while they're gone. So if anything happens while they're gone, they'll be covered.
Okay. Danielle, what advice would you give to someone who might be hesitant to make changes in their plans, even when you know that they will benefit them, just because sometimes change is hard, the mailman told them not to do it or whatever. How do you handle that?
I think that ultimately this is a personal choice, and so it's not my job to convince you to make a change or to choose something else. What I can do is I can share with you the impact that it could have on you. So we can talk about what that premium over 12 months, what that looks like, so what that cost to you is. We can talk about if you are hospitalized, here's what you're looking at. So I'm not a high pressure salesperson, that's just not my gig. I sell through education. So to me, if you're choosing to stay on a plan, there might be an emotional attachment that you have, and you feel comfortable and confident. And maybe it could save you $1,000 to go with a different plan, but you feel really comfortable and confident in the plan that you're on, then you should probably stick on that plan, if that is worth that to you. But it's my job, and all of us, our job is just to make sure that you have the education to understand the implications of the choices that you're making. And I don't mean implications from a negative perspective, just what it means to make the choices that you are making for the long term. So I would say, educate yourself, just know. And I think that we talked about different enrollment periods that you have, and I think that what we probably all of us find is that there's people who are making choices that don't understand the implications of guaranteed issue on a supplement plan during certain enrollment periods. And so maybe you start to have more medical needs, and you're paying quite a bit with your Advantage plan, and you'd like to look at a supplement plan. But at that point, going through underwriting for a supplement, because you don't have guaranteed issue from them, might not be an option any longer. But that's something that you should know when you're making those choices at the beginning. That's not something that you should know when you have needs for additional health care. Does that make sense to everybody? Yeah, so I'm not here, and I don't think any of us are here to push a plan on you. And I would say if you are with a broker or someone who you feel like they are really pushing a specific plan or trying to get you to make changes without a really, really firm understanding or knowledge about why they're making that recommendation, then you should absolutely have some like red alerts going off and try and consider, why would they be pushing me towards this plan or this path? And I think that that's, do you guys mind if we just talk about like the difference between brokers and maybe agent partners and SHIP? Because I think that there's space for all of it here. And I think that the need is so great out there for people to have advocates for them. So Dave and I are brokers. That means that we work with the insurance companies and we have a list of clients. And the way that we grow our business and the way that my business works is that that insurance carrier has contracted rates with me that I get paid for enrollment in different plans. So that's how my business works. You don't pay me anything. I spend time with you, and then if you choose to go with the plan that I go with, that I would recommend and I would sign you up for, then I would get compensation, and I would also be your agent on record. So if you call and you say, I'm getting this bill and I'm not understanding, I could help you navigate that a little bit more because I would be agent on record through that insurance carrier. With SHIP and with aging partners, they have fantastic volunteers who walk you through this process. When my father-in-law was having to navigate Medicare, we went and sat with SHIP for a really long time, and I had a ton of questions, and the gentleman I met with was fantastic and answered so much for us. So there's definitely space as well for the volunteer programs that they have for you to work with them. But the reason I wanted to bring that up is because I think that as you hear different things in the news, or maybe you're hearing about whether you should work with a broker, work with SHIP, different information like that, as long as you're an educated consumer, that's what matters. So last year there was a plan that decided that for the broker that if I signed a client up for their prescription drug plan, I did not receive compensation for that. And that's their choice as an organization to do that. They can change my contract. Then that's my choice as a broker if I'm going to present that to you as my client, whether I want to present that as an option. For me, my ethics and morals say I'm going to present you every single option regardless of what my compensation is. But if you're working with a broker that you're not sure that you're getting all that info, you need to reach out to someone else. You need to go to SHIP, you need to go to Medicare.gov, or you need to ask the broker, are you showing me all of your plans that are available? Or are you showing me the one that gets you a trip at the for 2026? And most brokers that I work with are absolutely on top of things and have a strong moral and ethical background that want to help, but it's super important to you. And so I guess that goes back, I'm sorry, I think I drank too much coffee this morning. It goes back to being an educated consumer so that you can make sure that whether you are guiding yourself or whoever is guiding you, you know enough to know that you're making the right decision. So I don't need to convince you to go with the plan. I need to educate you so that you can make the best choice for which plan makes sense.
Okay, great. Do you have anything, Eric, would you like to add anything to that?
You know, I think we at SHIP, at least we have a good relationship with brokers. I have brokers that call me on our 800 line and ask questions that I'm happy to answer. We certainly don't steer people away from brokers. We don't get a compensation for recommending plans because we don't recommend plans. We only provide that education. We do provide the education. This is how you can enroll. And if you want to enroll by finding a broker or having a broker that you work with, we tell them they can do that. We don't tell them, don't go to a broker, do this yourself. They can do it themselves as well. They could call and enroll themselves if they want to. But many people say, I've been working with somebody for many years. They've got a plan that I like. I'm like, great. If that works for you, that's great. We don't steer people away from brokers at all. And so we do have a good relationship. But I think that's why they do trust to call us, because they know they can do that without, feeling like we're stepping on toes or whatever. So.
Good. Eric, the next question is yours then. There are so many deadlines, like October 1st, I thought that was open enrollment, but no, it's a different date. So October 15th is open enrollment. You have to apply for Medicare by 65 or 62, I don't even know anymore. What are some of these key deadlines that we need to be aware of for during open enrollment or for signing up for Medicare? And how long does this open enrollment last? And what do we do during open enrollment?
So, okay, that's a lot of questions.
I know, yeah.
I hope I can remember all those questions. Well, certainly outside of open enrollment, but also during open enrollment, you have either your initial enrollment period for people that are turning 65 that are going to go on Medicare. That's 3 months before your birthday month, and 3 months after. So you have a 7-month window to enroll in Medicare at that time. If you delay Medicare, you would have a special enrollment period, and that would last as long as you have employer insurance, and then you can choose when you want to go on Medicare. Usually 2 months before your insurance ends through your employer, then you can apply for Medicare to start then. Some people lose their job, and sometimes they don't have a 2-month window, but certainly 2 months is what they will accept at Social Security to apply for Medicare. Certainly you have a window to purchase a supplement. You have a 6-month window, the month 1 being when Part B starts. So when you start Medicare and Part B starts, you have 6 months to purchase a Medigap plan, a supplement, without any health questions. After that 6-month period, they do not have to accept you into their plan if you have some health concerns. They will underwrite you and they can say, sorry, we don't want you. Okay? Also, Danielle, sorry about that, said, certainly you can shop for a Gap plan anytime. You can do that. Remember again that they don't have to accept you into that plan if you are outside your initial enrollment with that 6-month period. You can switch back and forth one time in your life between original Medicare and Medicare Advantage. You can't do that if you're in one of the plans more than 12 months, then you would be underwritten. So for example, if you started with a Medicare Advantage plan, and within that first year you decide, this is not for me, for whatever reason, and you want an original Medicare with a Medigap, you can go purchase one within that first 12 months, no questions on your health. If you're in that plan longer than 12 months, then they will underwrite you and they can say no. So it gives you really a 12-month period to do that. It's just the opposite with original Medicare. If you want to go try Medicare Advantage for 12 months, you can do that. If you decide this is not for me, you go back and get your Medigap plan, the same one you had before, no questions asked. Go longer than 12 months, they don't have to take you back. You can only do that one time in your lifetime. You cannot flip-flop back between those plans. You can make a switch like that one time during your lifetime. Who makes these rules? I don't know. It's not me.
No flip-flop.
Don't worry, they'll change it.
And they'll change it soon.
There's legislation.
There is legislation that we'll see how far it goes, because you know how the wheels of the legislature move. But a bill out there that would provide a one-time guarantee issue to switch your Medigap on your birthday month. If that passes, you could do that once a year without any questions. That would be fantastic. There's obviously lots of ramifications that go with that, costs and all those things could rise. We don't know any of that yet, but certainly that would be great for people that can't switch their plan because they have health issues and they're in that plan and they can't change. So if that bill would go through, it would give you the opportunity to do that once a year at your birthday month. During open enrollment, certainly that starts October 15th through December 7th. During that time, you can change your drug plan or your Medicare Advantage plan to another plan, no questions asked. You don't have to go through any underwriting to do that. If you don't have to change your plan during that time, if you're happy with it, and it is going to continue as a plan in the next year, you can stay with that plan. You don't have to re-enroll in another plan. It would just go with you. Again, make sure you review it with someone so that you know that plan is the best plan for you in the next year. There's also a Medicare Advantage open enrollment window, which is actually January 1 through the end of March, where you can also make a change if you have a Medicare Advantage plan. You can also go from Medicare Advantage to original Medicare at that time if you would like. Again, you have to be underwritten properly for your Medigap plan, but you can make that switch during that January through March window to go back to original Medicare if you would like, but again, not guaranteed to have a Medigap plan. I'm sure there's lots of other windows that I forgot.
So am I right? You can't flip-flop unless it's in an open enrollment, but you can flip-flop during open enrollment?
Depending on the plan you have.
Okay. So
Okay.
it all depends.
It depends. That's what we say. It depends.
Yeah, okay.
Certainly, yes.
The Medicare Advantage plan is, you're in it for the year, once you sign
They
up.
can't hear you, Dave.
Oh, my bad. The Medicare Advantage plan is a one-year plan, just like when you worked. And they give you the opportunity during the year, which is AEP, which is what it's called, to look at your plan, and if you want to do something different, you can change, but it won't go into effect, so you know, until January 1st. And one of the other things I think you all should know is today we can show you the plans. We couldn't do that before today, but we can't write it. We're allowed to show it to you between now and the 15th. And well, obviously after the 15th, but this is a little pre-AEP time where we can come out to your home and show you what's available to you. Okay, we don't have to wait until the 15th. We do have to wait till the 15th to enroll you, but up until now, today's the day.
Okay.
Can I just make a little add to that? Different for us at SHIP, we do not show plans to people until after the 15th of October. Even though we get that information, we do not provide it until open enrollment, which starts October 15th. Though I know many of you probably got a Medicare new book and probably saw the plans way before October 1st, because many people came into my office with the book and had plans, and I hadn't seen any of them. So sometimes you get that before anybody sees it, and really October 1st is the day that you can actually look at them. But in our office, we don't provide that information, so if you would call now and say, could you tell me about a plan, I would say you'd have to make an appointment after October 15th to do that.
Okay, good to know. Molly, so people's circumstances change, these plans change. How do you help someone identify if their current plan is still meeting their needs, and how often should we come in and have it reviewed by somebody?
So definitely come in during the open enrollment period, either the October 15th through December 7th or the January through March period. And again, we just sit down with people, we go over the options. So maybe you got a new drug that's added, maybe your plan's going away, maybe your plan premium has increased, maybe you're on an Advantage plan and the max out of pocket is too much, your doctor's leaving the network, you're moving to a different area. All of those things can impact what is the best option. So we talk about all of that. We look at what are your costs on your current plan, what will they be next year? Is your drug covered? Is your doctor in network? Is the over-the-counter benefit that you like what you want it to be? Is dental going to be an important coverage that you need? So we look at all of those things. And then anytime you have a question or anytime you have a change, even throughout the year, let's say you get a new drug added, I might not be able to switch your plan, but I can prep you for what your costs are going to be. We can look to see if you're eligible for anything. Is there a patient assistance program we can apply for? So anytime there's a change in your health, in your medications, the doctors that you're seeing, call come in. I will meet with anybody anytime for any question, but definitely, I know we've said it like 8 times. Come during open enrollment, check your plan out during open enrollment so we can make sure you are in the plan that's best for you.
Where are you at? Where do we come?
Aging Partners is at 600 South 70th.
600 South, thank you.
Yes.
With old VA, the
Yep,
old VA
the old
hospital
VA
building.
building. Yeah.
Right behind.
Yes.
Drive all that.
If you
road
drive
behind.
down O Street, okay, 10050 is where we used to be. There's a big banner that says Aging Partners. We are not there. Please do not go to O Street. Please come to 600 South 70th. And then we do have, if you're out in the counties, we have some offices outside of Lincoln. So if you're in a different area, you certainly can go to one of those offices.
So Dave, I'm gonna ask you a little bit different question about supplemental insurance. And how does supplemental insurance play in your overall retirement planning? Is that part of that too?
Yes. Anything you do at this time in your life is important to you, and that's a piece. But we also need to know that there are other pieces to go with it as well. The good thing is we have some of those other things, but right now today's focus is going to be on a Medicare supplement or a Medicare Advantage, one of those 2 things, because that's what's important to you right now. I'm sure of it. So choosing the right one out of the gate is important to you as well, you know, because like Danielle says, you're not choosing for today, really. You're choosing for down the road. And, you know, a Medicare supplement could be a vital piece in that choice. You know, you want to control your future. So one of the ways you can control it is get in the right plan that is right for you, not for your neighbor. You know, one of the things that we, you know, having done this 16 years is the stories you hear. Oh, well, my neighbor's got this one, so that's what I'm going to take. When in reality, that's not really how you should make your decisions, you know. So, that kind of...
Yeah. Danielle, we all like our doctors. Some of us were really attached to our doctors, or we might be attached to a specific hospital or a different clinic. How do you know if your doctor is going to be in your plan, and how do you evaluate that? And then what happens if it's an emergency and you go to one of those hospitals or doctors that weren't in your plan?
Yeah, great question. And I think we spoke to some of that in regards to if you're traveling somewhere and there's an emergency situation within the United States, you will be covered if you need to seek emergency services. But otherwise, I know the computer can be a fantastic thing. It can be a really frustrating thing. But you have a great opportunity to get onto your whatever insurance company you go through if you have an Advantage plan and take a look at all of the different doctors and providers that are in network. And they've done a really great job of trying to streamline it as much as possible and make it as easy and simple as possible for you. So when you go in and you're taking a look this year at your different plan options, that's definitely something that with meeting with Chip, Aging Partners, Dave, or myself, you're going to want to bring the list of doctors that you see, any specialists that you see, and your prescriptions that you're currently on. Because then we can take a look and say, okay, well this plan, while you've had it before, maybe it's not covering your drugs at the same rate that some other plans could. Or maybe you do have a doctor that's no longer in network. So we're able to help navigate that for you to make sure the doctors that you want to see are ones that are going to be an option for you on your plan and in network. And it depends on if you go with an HMO plan or a PPO plan for Advantage plans. And then with your supplement, you have a little bit more leeway as far as who you can see and who you can't see. So that also is when we start having those conversations at the beginning about who you want to go to, what specialists you plan to see, what doctors you want to go to. That's part of that conversation is do you want to see whoever you want to see without having to get any type of referral or having to go through any insurance company deciding who you can see and what you can see them for? That's a part of that holistic conversation about how you want to engage with your healthcare as you age. So I think taking a look, making sure that your hospitals, your doctors are in network. We had last year, it was kind of a wonky thing that we had an insurance carrier that had been in network with a really large provider that ended up pulling out of, they had contract negotiations that didn't work out. So I would like to say that if you chose an Advantage plan that had your provider, you would be set for the year. Unfortunately, I can't tell you that. So that's where that would be a follow-up visit with someone to say, okay, if this person is no longer accepting my plan, what are some of my other options? How can I work around that? I know there were some providers that provided their own workaround for that situation. So you can be the most educated consumer you can be at the outset. That's always our goal, but also there's shifts and changes that happen that we just have to adapt to. And then that's where this annual enrollment period, then you need to sit down and say, if you are still wanting to go to the hospital or the doctor that you had been in, how can I make sure that I choose the plan that's gonna be covered?
Good. Eric, I think this will be the last question because we are kind of short on time, but a lot of things have been covered, and we do want to get to all of your questions. But Eric, sometimes people are caring for a family member, and what tips would you have for someone who might be navigating Medicare while they're caring for a senior family member and making those decisions for them? What would they do?
We do get a lot of calls from children, spouses, and brothers and sisters that are taking care of people who need that extra help, helping them make their choices with whatever they're doing in their insurance life. I would say make sure that if you're one of those people that you have their paperwork and everything that they need. That happens a lot of times that they'll come and they won't have what insurance plan they have. They have no idea what insurance they have. Or they don't know where to access their Medicare card or number. Or any of those important documents that you need, their social security card. So if you're going to be doing that, or if you are helping someone, make sure that you're able to access that type of information. You may even need to be a certain, just a documented person that can assist people. So if you have to go get a, what am I trying to say? Power of attorney, thank you. Power of attorney to do that. You may need to do that if they need that much help. But certainly if you're just assisting someone, making sure what they have. And you may not be able to find those things in their home, but you don't know where to go to look. Certainly we can assist with some of that information. If you can't find their Medicare number, we can assist you with that at the SHIP office. We're forwarded a direct line to Medicare. I know Molly has the same access to do that. She can call Medicare, and it's not the 1-800 Medicare number. We have a different number that we have to provide information. We have to go through training to do it because it is confidential information, but we can get information on possibly what plan they have, if they have a drug plan, Medicare Advantage plan, or even their Medicare number. We can usually get that from them as well. We can't look up a supplement. Unfortunately, they don't provide us with that information. But certainly we can help with some of that, and I know that some other people can as well. But certainly if you're assisting people, having all that organized for them will certainly help them greatly.
Okay, great. So we're going to turn it over for questions. Before we do that, I just want to remind you, you have an evaluation on your table. If you want to start filling those out, because we'll take them all, and the ones who are complete, we do want you to complete it all, then we'll have a drawing for some wonderful door prizes. Do we have a mic free to pass around the room? Okay, right here. So, who has questions? We all have a lot of questions. We got one over here. We'll go ahead and get started here. We'll get a mic here coming for you. And then whoever on the panel wants to jump in and feel free to do so.
This is not an important question. We just didn't get the evaluation at this table.
Yeah, we don't either.
You what?
We don't have the evaluation form.
You don't have an evaluation on the table?
No.
Okay. Well, make sure that you get one.
None of us do.
Okay, do we have any Medicare questions? Over here, we got a couple.
You mentioned that we have a cap on the Part D of $2,100 for this coming up year. Can you just pay that up front and don't pay anything for the rest?
Yes, you can.
Who would you pay it to? I didn't hear.
Your pharmacist.
Oh, okay.
Yeah, well, when they had the donut hole, people used to do that, because they don't want to be devastated, but if they are devastated, they want it to happen at one time. You know, not stretch it out over a period of time, so.
Can I add to that? I just want to say, it would be important to check to see if you're going to hit that cap, because there are people who have very, very low cost drugs, and you may never hit the 2,100. And if you're going to hit the 2,100, maybe it makes sense for you to just rip the Band-Aid off, so to speak. But if you're not ever going to be bad, that's going to create probably a giant mess for your pharmacy. So double check what your costs will be for the year. And you may have a medication you're on now, or you come off of it later, that sort of thing. So it's probably important to check all of those variables before you do shell out that money.
I think we mentioned the prescription payment plan. So if you do think, and that would be something to have a conversation with your pharmacy on, if you do think you are on medications that you for sure will hit that 2,100, then you can also have conversations if you want to pay up front, but also maybe it makes sense to do the monthly payment. So then you have just a little under $200 you're making payment each month versus variable cost throughout the year that might be, and that would be something that you would pay to the insurance company versus to the pharmacy. So the insurance company is supposed to be billing you for that prescription payment plan. If you were enrolled in 2025, you will continue enrollment in 2026. Otherwise, you can enroll at any time in that as well.
Okay, next question.
I have a couple questions. First, you talk about Medicare, Plan B, and supplement. Same thing?
Here, clarify those Medigap
Certainly, so
plans.
a Medigap is a supplement plan. Same thing. So if we were using those terms as a Medigap plan, that is your supplement, okay? Part B is the outpatient portion of your Medicare, Part B. So you're paying that premium, this year it's $185. You pay to Part B to have that insurance. And the Medigap then picks up, or the supplement picks up the portion that Part B does not cover.
Okay, thank you.
Does that help?
Yes.
Okay.
So here's my next question. If I decided on Medicare Advantage in September and signed up, or October, whenever I can, and then I have an injury and I need a knee replacement in December, and I find out it's going to cost me $10,000, can I switch back to, can I get off of Medicare Advantage and go to a supplement?
Within the first year, yes, you can. You can change your mind, so to speak.
So this is called a trial right period. So if you had a supplement and then you chose to go on an advantage plan, maybe you were like, supplement, I'm just paying so much money for it, I want to consider an advantage plan instead. So you went on the advantage plan. You have 1 year from the time that you switch from that supplement to an advantage plan that you could use your trial right, that you could go back to the plan that you had the supplement plan that you had previously been on. If it's outside of that 1 year window, you wouldn't have that option.
Well, what if I never had a supplement? I started out with Medicare Advantage.
If you started out with Medicare Advantage plan, so if you start out engaging with Medicare Advantage and you're outside of your open enrollment period, then you would have to go through underwriting. So you're no longer within a guaranteed issue window. So if you don't have any medical issues, then there's a lot of plans that might be an option. If you do have a lot of prescriptions or some health history, then it would be the That's where we look at different supplement policies, different carriers ask different health questions. So we would go through and kind of decide if it would make sense or if you could pass underwriting. Does that answer that?
Questions?
If thinking about that barbecue.
Oh.
My mom does not, she has an insurance agent that she works with. She's been very happy with her supplement. And every single year, agents come to her home. And she's not calling people, but she's getting unsolicited visits from other agents trying to get her to drop her Plan G and enroll in a Medicare Advantage plan. Is that something that they can do? How can we, I can't be at her house all the time. How can I protect her? How do we make this stop? It's really scary.
So are they just stopping at her house without being invited, or are they calling and making an appointment with her? How's that working?
I know that a couple of times she's called me after someone has called her and said this person wants to come over and do Medicare education. We're already educated, we don't need that, and I've had to call these agents back and tell them not to come, and one of them came anyhow. And I know this happens to other people. I have other friends my age whose parents undergo the same stressful time.
I know I get at least 5 to 10 phone calls a day from Medicare.
Insurance brokers are not supposed to come to your door unsolicited. If they've made a contact with you and you've spoken to them and they ask to come to your home, that's okay. They are not supposed to go door to door and knock on doors to do that. If that happens, unfortunately, and it does happen a lot because we hear about it, and you're not there to protect them, it's very difficult. If you can get the information, they can file a complaint with the Department of Insurance. And that happens as well. Sometimes it doesn't go anywhere, and sometimes it does. I think there's so much of it that, and certainly, you know, I'm not, again, harping on the brokers, but there are brokers that do that. And that's not the way they should be educating. Like Danielle said, you know, she's not pushing plans on people or going door to door to do that. So if they are doing that, the best way to do that is to keep reporting. I don't know any other recourse that you can do that other than chase them off your porch.
One other question then, if she does, or if somebody does get enrolled in something they don't fully understand during open enrollment, how can you get back out of that? Is there like a 3-day window to reverse it, or how can people get out of something if they don't really understand it?
So that's a really great question. And if you're in the open enrollment period window, the last application that's submitted is the one that will become effective on the first of the year. Where that gets a little bit tricky is, I mean, there's always situations that I would say at that point, immediately reach out to SHIP, aging partners, if you have a broker you know that you trust, to ask them to help you navigate that specifically with the carrier, because it might be carrier specific. And I think in this situation, it gets a little bit slippery, and unfortunately there are brokers out there that don't give Dave and I a good look because of the tactics that they use, because I technically can door knock on selling a supplement plan. I am, as a broker, able to do that. Now, if they say, I'm here to talk about your supplement, and then they navigate into the Advantage plan, we have very strict rules that we have to follow. We have to have a scope of appointment that's filled out 48 hours prior to meeting with anyone. And on that, they have to fill out what different products they're open to talking about, whether it's prescription drug plan, Medigap or Medicare supplement plan, or an Advantage plan. So we have very, very strict guidelines we have to follow. They are for sure going outside of those guidelines. So absolutely letting them know that you will be reported. If she needs a sticker on her window saying, if you are here to sell me an Advantage plan, you can contact the Department of Insurance or contact my broker at this number, but do not ring or knock on my door. If that's something that's really happening to her, then I think that's, go ahead and just head it off at the pass and say, if you're here to sell me an Advantage plan, I will report you to the Department of Insurance.
And I want to reiterate what Danielle said. There are bad people out there wanting to do underhanded things to make a buck. I know we're not them. I can tell you I've done this 16 years. I've door knocked is what it's called, twice. And that was my first week out. I've always had this rule, because I possess a Medicare Advantage license, I can't do that. I can't be that person that comes to your mom's house. I won't do that, because we're not allowed to do that by law, really.
And it's unfortunate, but in every profession, there are those that are going to take advantage of people. And for some reason, they seem to think that people over 55 are dumb and stupid and don't know what we're doing. But we're here to prove them wrong, because we do have resources to combat those. And there are agencies that you can report these bad flavors to. So, other questions? That's all the questions? I thought we would be here all night long for questions, but that's okay. We'll move on here. So just some things I wanted to remind you guys about that are coming up. We offer a downsizing club. If anybody is looking to downsize and make their life a little bit freer, it could be downsizing from a 2-story home to a single-level home, or from a townhouse or single-level home into some type of senior living. We have a downsizing club. We have Senior Stories podcast. Every one of you, when I look out of here, I know every one of you have a story, and you have something to share, and this could be your legacy. And so we're always looking for seniors. You have to be 55 or older, but share your story with us and help us, because you never know. Some of the troubles and the trials that you've been through could be something that would be helpful to somebody else, so that they know that they're not alone. So if you want to be involved in that Senior Stories podcast, reach out to TJ. He's the one who does those. And we are going to do the door prices, but first of all, we're going to have our educational partners come up, and we want you guys to meet these people. So what our educational partners are, these are people who help us put on our educational seminars. You can't just be an educational partner, you can't just show up. You have to be vetted. You have to, I have to ask you a lot of different questions. I have to find out how you're doing your business. One of the criteria for being an educational partner is you have to be honest, you have to be fair, you have to provide your services at a reasonable rate. When you say you're going to show up, you need to show up and you need to be there. And you also need to offer a free first consultation. So all these wonderful vendors and business people are vetted, and they are very highly respected by us in our program. So we have a microphone to pass around to the education partners so that they can introduce themselves. And as they're doing that, I want you to look at these evaluations. On the back, you can actually sign up for one of these free consultations. And if you want one of those, just write down who you want that consultation with, and we'll make sure we get that set up for you. So we're going to, do you have a mic?
Where does it say you can sign up for a consultation?
They'll just use one of these.
No one picked up our evaluation. What's that, Nene? No one picked up our evaluation. We'll get it up. Oh, here's the mic. Okay.
Hi everyone, my name is Reagan Oberl. I'm with the Alzheimer's Association. So what we do is that we provide free programming here in Lincoln and across the states. We have support groups. We also have our ALZ.org, and we provide all information about Alzheimer's. One thing that's we have 2 exciting events coming up. Tomorrow at Aging Partners from 2 to 5, we have our Alzheimer's putting the puzzle of pieces together resource fair. We invite everybody to come. You can just come to Aging Partners at 2 o'clock and it lasts till 5. And then my favorite group is we're having the Walk 10 Alzheimer's happening on October 5th. Also at Victory Park by Aging Partners. The registration starts at 11. Coming to the walk is an absolutely free thing you can do. All you have to do is just come up and you can register there. We would love to see you. And I hope you all have a great day. Thank you. Oh, and I have just a little swag bag of ALZ stuff for the prize today.
Great, thank you.
Good timing. All right, Tanya Gavin, OASIS Senior Advisors. We are a free service to seniors and their families, getting them connected with the resources they need, whatever it is, at whatever time. Who loves doing dishes? I am shocked. All right, so if you've met my teammate Kelsey, she is creative. She has put together a how to make dishes fun kit. And this cute little loaf pan, it's a ceramic pan. So all the fun fall themed, the colors, the sunflowers, the pumpkins, all of that. So that's what we have.
Hello everyone, my name is Natalia Page. I am a wealth advisor with Chloe Wealth here in town. We're a full financial planning firm. More specifically for this group, we do help people who are either downsizing, retiring, making a big life change, unfortunately maybe having to put in a spouse or a loved one into an assisted living facility. We help with those decisions, review financial statements and things of that nature to make sure that that is the right move for you. I do not have as fun of a gift as Tanya does, but I do have some chocolates with a Target gift card.
Hi, Josh Henderman. I'm an estate planning attorney. So happy to help whether you have, maybe you have an existing plan, some life changes happen, you just want to sit down and chat and know is what I have still what's going to work for me, or maybe you haven't put anything in place, wills, trusts, powers of attorney, all things estate planning. And I just have a restaurant gift card for the Metal Grill here in town.
Hi, I'm Rodney with Archwell Health. I'd like to introduce my new market growth manager, Jamie. She is brand new, not new to Archwell, she's been here for over a year, but new as our manager. So I want to bring her along and introduce her to everybody. You've got to hear me speak for months on end, so maybe Jamie has something new to say. We are primary care doctors for seniors on Medicare Advantage plans. We're currently taking United Healthcare, Aetna, Humana, and now Devoted, which is new to Nebraska this year. So I'll introduce Jamie and let her say her spiel.
Yeah. So thanks, Rodney. I'm happy to be here for the first time. Archwell Health is more than just primary care. You should stop by. We have a calendar of our October events. I was looking at it today because I'm actually out of Omaha. There's a lot of fun things going on. As everyone's being introduced, it's fun to hear who else is all here because Archwell also does a lot of networking in the community and partnering with people, insurance brokers and all sorts of different people. I was on the phone in the back trying to help someone. They were looking for a new home, a new place with her aging mother. So come check us out, and I'm happy to be here.
What you got for your prize today?
Yes, of course. We have this big, tailgate basket full of a whole bunch of goodies.
Hello, I'm Wendy with Organized by Design. We service the Lincoln and surrounding areas. We help people with the hand-holding while they're doing downsizing, organizing, then we do the packing, and we do the unpacking, and the idea is that we have your home or your space set up the day of your move without any boxes, without any totes that we need to put away, even put pictures on the wall. So if you're looking at moving, come visit our website, visit our table. We also are giving away an hour of organization. So if you stop by our booth, if you haven't registered already. And I have, as you could see, our theme is a Husker table, but my mom graciously said, everybody likes these pot holders for a Husker theme and a little dish.
Hi, I'm Susan from Sage Living by Tabitha. We are Tabitha's independent living community. So we are 55 plus, and what makes us really unique and special is we have the intergenerational model. So we have college students also living in our community, particularly Brian, college of nursing student. So really, really great group of students. We have 15 students this year, and it's been tons of fun getting to know and interact with all the new students. Today I brought a ceramic fall pumpkin. But I also want to let you know, not only are we having our barbecue directly after the seminar today, we're located right off of 47th and L Street. So come on over for some barbecue food. We'd love to have you. But I also want to let you know about another event that we're having this month as well, kind of going along with some of those fraud cases that we talked about. We are having a fraud prevention speaker. I gotta get my dates right here. October 14th, we have a 6:30 p.m. Seminar, and then October 29th is 10:30 a.m. It's the exact same content in each seminar, it's just giving you different time options. So come on over. It's going to be cybersecurity with Ryan from the Nebraska Attorney General's office, giving you all that information to keep you safe on your computers and on your phones. So hope to see you there. Thank you.
You guys have heard a lot from me already today. So Danielle, a new Dawn Insurance, I have a fun Dia de los Muertos planter for you.
Wow. Sorry. My name is Dave Tuttle. I am employed by American Senior Benefits. I do everything.
My name is Val Edom. I work at Caring Friends in Home Care. We do non-medical and home care services in 30 counties throughout Nebraska. We care for individuals from pediatric to geriatric, caring for them in ways that are personal care related, home care related, and companionship, so we can provide services that help somebody support them through an injury or illness, or help them as they age at home. And I brought a Colby Ridge popcorn and chocolate-covered potato chip snack pack, so you can share with your friends at your table or take them home and keep them to yourself. Take them home.
Hello, I'm Bud Thompson with Nebraska Realty out of Omaha. I'm also a member of Alicia's team, the Nebraska Specialty Group, and I guess we're one of the sponsoring members as a team of Nebraska Realty agents. And what I brought, my wife picked out for me, is a ceramic pumpkin full of candy. Also, I brought down a bunch of newspapers from Omaha. These are New Horizons. They're put out by the Eastern Nebraska Office on Aging. They come out once a month. They're free. If they're, I have a whole pile of them back there. Just pick one up and subscribe, because you'll learn a lot about what's happening in general, and also you'll see what events are happening around Omaha. So if you got friends, relatives that are in Omaha that'd like to come to something like this, Alicia's gonna kick this off in Omaha probably January, and it'll be probably almost the same program as what you see here.
Doug Kelton with St. Mark's. We do bus trips for seniors every month. And so I've got a bus trip going to Picnic Hill Orchard. And so we get one free admission if you want to go with us on that.
Where's Picnic Hill Orchard?
5 miles straight south of here.
Okay.
Yep. And then we're going out to the Nebraska Community Playhouse in Hickman on Sunday, October 12th, to see a play called Walnut Ridge, and it's about the Beatles stopping in Walnut Ridge, Arkansas overnight, and it's the story, an actual true story, and they put it into a play. So if you're interested, if you win, you get to go free with us.
I'm Bert Quinlan. Reagan has already announced her prize for Alzheimer's. Want to encourage everybody to come out tomorrow to Aging Partners for a dementia information show, and Sunday for the Alzheimer walk. Also at Aging Partners Sunday.
Okay. All right. So we have the evaluation. Oh, who brought a friend who has not been here before? Raise your hand, and TJ can pick something out of the basket. And then, can we get Eric and Molly to come up and make a few friends and do our drawing for us today? And where are all those evaluations? Here they are. for Oasis. Pick one, yeah. Pick a lucky one. Okay. Butch Hopkins, where are you, Butch? Are you still here? There you are. Okay, next one. Look at Molly. And this person will get one from Chloe Well. Phyllis Stops. Phyllis, are you here? Okay, come on. Next one, Eric. All right, thank you. Sharon Kelly. Okay. And Molly has Lee Green. Lee, do you win something every time? Okay. Okay. Paula Enneman. Okay, Paula, go ahead. Get the next one. And how about Alan Neely? Okay. Got a couple left. Dwayne Westing. Where's Dwayne? Oh, you're in front. Okay. And Americans Benefits. Lori Lindgren. Where's Lori? Okay. That's some new winners. And Linda Hodges. Linda, are you here? Yay. Okay. And we got Bud's here. How about Karen Westman? Okay. And Deb Fountain. Where's Deb? Okay, we got one left, and that's the two left. Oh, okay, we got Rochelle. Was Rochelle still here? Rochelle, you're going to go on the bus trip. And who gets else to go on the other bus trip? Andrea Dufree? Okay. All right. Okay. Well, thanks so much for filling out those evaluations. Eric and Molly, do you have anything I forgot to ask you? Is there anything that you'd like to add? Okay. Okay. Well, thank you so much for coming. We really appreciate you being here and sharing all your information. And people know how to get a hold of you if they need some more information. So remember